Thank you everyone for joining our ScienceHolic's first workshop in our conference, the Medical Week Conference 2021. It's our first ever conference, so we're still quite new at this, events organizing. So forgive us for any not mistakes, let's just say. So the session today is caring for others and doctors and nurses, and we have two amazing panelists here today to speak with us about their expertise and professions. But before we begin, let me introduce myself. I'm Scarlett. I'm the Communications Director of ScienceHolic, and I'll be the host of today's webinar.
Hi, my name is Jessica, and I'm an ambassador for ScienceHolic, and I'm also one of the outreach team members.
Hey guys, this is Joyce, and I'm the co-founder of ScienceHolic, and I hope you guys have a great workshop.
Before we move on and introduce the panelists, I'd like to give a brief rundown of what ScienceHolic is as an organization. So we are a new front nonprofit that aims to introduce intricate scientific concepts in a manner that's fun and comprehensive to teens. Our main purpose and our mission is to serve as a free resource for students to learn more about various STEM topics. And we also provide various opportunities for students around the world with English as their second language, as all three of our members here currently, to expand their English ability and provide unique volunteer and leadership opportunities. We have several sub-branches, which include our seasonal magazine editions. We recently launched our spring edition, our webinars, and our newly established bi-yearly review, which we'll address later on, and along with our monthly blogs, articles, and fine scientific facts. So thank you for joining us, and I'll be a small organization in this event. Without further ado, let's introduce the panelists for today. Sorry. Simone, would you like to begin?
Hello, everybody. My name is Simone. I am a bachelor prepared registered nurse, and I'm also a certified pediatric nurse. I am located in Texas, usually, and I recently started a new business. It's called Diabetes Simplified, where I am helping type 1 diabetics with feeling empowered and finding that control in their day-to-day life of living with diabetes. I am also a type 1 diabetic, so this is near and dear to my heart. I graduated from Texas Tech, and that's where I got my bachelor's, but I actually started with an associate's degree in nursing, and I also have a degree in psychology pre-med. So kind of just, you start one way and then you sometimes have to go another. So I've learned over the years, this is which way I'm gonna go. I do a lot of advocacy work. I am diehard about insulin for all because insulin prices are skyrocketing in the United States compared to what they were when I was even diagnosed with diabetes 24 years ago. I am also a student nurse mentor, and just, I know how hard nursing school was for me. So being able to help other students with pushing forward and getting through nursing school and all the challenges that it brings. My hobbies are traveling, which I'm currently in Aruba right now, so I stick to that hobby always. I love to read. I feel like knowledge is power, and I'm definitely into sports. So at the bottom, you can see my logo. It's Diabetes Simplified, Finding Your Sweet Spot. And that's me.
Thank you so much. Forgive my background noise. I'm sorry about that. But Tricia, would you like to introduce yourself next?
Hi, I'm Tricia. I also go by Trish. I am a transplant or surgical ICU nurse, and I basically started a YouTube channel about last year because I realized that as a new grad or someone who is interested in nursing, I didn't find a lot of resources on what nursing did specifically or how to get into specialty or even to finding like the right school that you would want to go to. And so in realizing that there was a need for that I was able to bridge my love for making videos and kind of being able to mentor all in one place. And so that's where my YouTube channel was born out of. I graduated from UCLA in 2017, and I've been working as an ICU nurse for four years now. I also am a nurse mentor, so I help a lot of new grads, not only at my work, but also just like those who reach out to me. So if any of you guys are interested in nursing, I'm super happy to just like reach out to me on Instagram. Is the best place to kind of find me. Emails kind of get lost, but Instagram is a good place to reach me, and I'm open to answering any questions. I also love to snowboard. That's what I do on my side hobby, and exploring restaurants and food. So I am actually in Texas right now. Yeah.
Thank you, Tricia, for your introduction. We'll skip the other two attendees. The other two attendees were scheduled to be here for their introductions for now, but for time's sake, we can move on to the first question. But before that, I'm sorry. To attendees, if you have any questions, please send them in the chat. We'll try to go over them at the end of the webinar if they haven't been answered already. Without further ado, let's begin. So, what do you think doctors and nurses have in common? Them being the most commonly talked about profession in healthcare, and maybe what are some misconceptions of being, taking these two professions on?
So for me, I feel like they are definitely both respectful professions. Of course, both formally trained. In a way, they complement each other. And I feel like as far as a commonality is, we are striving for the same goal. When I'm working with any doctor, I feel like the goal for us is just optimal health for any of the patients that we have, and just making sure that they get the care that they need, as well as the family that's with them, because I feel like it's about the patient, but you have to also think about the family, and there's so many factors that go into it, but in the end, we're focused on reaching the same goal.
I agree a lot with Simone. I think that doctors and nurses both do an equal job in taking care of the patients, and they do so separately, but also together. It's a mixture of being able to talk to one another and really understanding what the patient needs, what the family needs, and kind of putting that in a way that's very safe so that we can provide the best care for the patient.
For that second question, some of the misconceptions, since you have myself and Trish here, I feel like one of them is that nurses are always women, all women. There are not male nurses. So that is one of the misconceptions I get. I have so many people that are surprised, like the hospital I worked in, there were some floors with male nurses, but they're out there. And so that's one of the misconceptions I see. Another one is that sometimes I hear things like, oh, you became a nurse because you couldn't become a doctor. I don't agree. Everybody chooses their path, whichever way you go. They're both great fields, and I'm happy to be a nurse. And I think those are kind of two of the misconceptions I hear a lot of the time.
I definitely hear a lot that a big misconception about being a nurse is that they're kind of under like that doctors are our bosses, which aren't true. We actually have a whole chain of command as a nurse. So you have as a bedside nurse, I have a charge nurse who is above me who oversees all the bedside nurses on my floor. And then above her, I have a nurse unit director and a nurse educator on my unit who help to educate us on basically all of the new and upcoming studies and like how we are treating our patients, essentially like the best way to take care of them. They update us on that, and also just make sure that overall that we're being safe and that we are being treated fairly, essentially, and like being able to do our job in a safe way. And then above them, there's another nurse who takes care of the ICU nurses as a whole. And then above them, there's a nurse above that. So there's definitely a chain of command. And you will also see that doctors have their own chain of command and their own bosses that are above them. And so with that, a misconception is like, so doctors are the ones who write the orders and nurses will execute the orders and help to basically kind of carry out that order, like what we want for the patient to happen. But essentially with that, sometimes you have to go ahead and think about what this doctor is asking and think about if this is safe for your patient. You don't just carry out orders as a nurse just because a doctor says it. You need to use your own clinical judgment and see if this is safe for that patient, and then if it's something that you can carry out. And if it's not, then you have to have that discussion with that doctor and be able to talk to them and not be afraid of them, because they're your colleague at the end of the day, and they should be able to help you and want the best for that patient.
I agree. Growing up, it's always been, any cartoon photos, you'll always see a doctor sitting down and the nurse just standing off the side, just listening to everything he says. So I'm very happy that you two addressed this misconception and somewhat dispelled it, because I feel like that line.
Yeah, and it's a big misconception for sure. Just because depending on where you live or where you come from, like for me, I'm Filipino, so I have family members in the Philippines who nursing is their pathway to becoming a doctor, and that's totally fair, because I think that that's a great way to learn about patients at the bedside, and then you proceed to more of an overall management view of a patient as a doctor. And so I think that's very fair for them, where they have that training as a nurse and they know what it's like to work bedside, but then in transitioning to become a doctor, they work more on the management side of the patient. And so they can see both sides, but because of that aspect of training where they live, they believe that nursing is just a stepping stone and that it's not necessarily like the end goal for some people.
Yes, I definitely agree with you, Trish. I have met several nurses from various places, and depending on where you live, like it's not, in some places it's not respectful for the nurse to speak up to the doctor. So in those locations, the nurses may actually just be doing whatever the doctor orders. It's kind of hard, and it depends on culture. And it's also, as being a nurse, learning different things about when my patients are from different cultures and what's respectful for that culture versus what I'm used to being a nurse, just being American my whole life and not really understanding or having firsthand growing up with those types of things. So it's interesting to see how nursing is different across the board when you're in different areas. But of course, like Trish said, here we value safety. Safety comes first. If there's something that I see and I question and I say, no, this is not safe, I will go speak up. And that's a major part of nursing, making sure that you're the advocate for your patient.
Thank you for talking about that. I didn't know, that nurses can also discuss to the doctor about it. So thank you for shedding light on that. Moving on. So, you guys are talking about, what's basically what a nurse does. And because I don't think we'll be able to talk about this perfectly, how about we talk about how can someone become a nurse? What programs, degrees, trainings, what profs they can take. Can you take a pre-med? Do you need to go straight to a nursing degree? Could you talk about that briefly?
There are many different paths to becoming a nurse. I'm going to start with the one that I did, just because I'm the most familiar with it. But I went straight from high school and applied to a 4-year university to become a nurse. When you apply to a 4-year university, you can either go on a pre-nursing track, which means that you apply and then you are put with a class of people who also have a pre-nursing interest. You might take some pre-nursing requisites, and then at the end, ultimately, you test for a spot into the nursing program. You can also apply directly to a nursing program, which is what I did at UCLA. You're not pre-nursing, you're admitted straight into the nursing program. And with each university, they structure their nursing classes in different ways, meaning you might do clinicals, you might do a lot of your pre-nursing requisites first, and then as you move on through the years, or maybe in the next semester, you'll start to go to clinicals, which just means that you will be working in the hospital, shadowing a nurse and learning kind of the clinical techniques of how to become a nurse. So, and with that 4-year program, you usually obtain a BSN, which is what I did, which is a Bachelor's of Science in Nursing, which for me was really good because I wanted to work in a really big teaching hospital where I live. So sometimes when you don't have a bachelor's in nursing, they'll ask you to actually go back. You can still apply, but they'll ask you to go back and get a bachelor's to be able to apply for a job in certain places. And it just depends on where you live and like what the hospitals are looking for. There are also other types of programs in the sense where you can get your ADN and you can bridge into getting a BSN. So at my local community college, they have a bridge program where you take, is it like 2 years to get an ADN, and then you'll bridge over and you'll take another few years to get your BSN, and they're already contracted out. I think you can pick like what university you want to go to take the other 2 years, I believe, to get your BSN. And so they have a bridge program there. If you don't do it straight out of high school, there are so many other options, but you can definitely come back. Like they have advanced, or they call it accelerated programs. So I had a cousin who actually had his degree. I think he had BA in a whole different degree. And then what he decided to do was he wanted to go back into nursing school. And what you can do is you can either get a bachelor's if you want to in nursing as well for that, or you can do a master's in nursing. And even though it's a master's level degree, you're still as an entry level nurse. So the same as you would be if you're a bachelor's, but you have a master's for that instead. Those are similar. Let me know if this is confusing, but those are similar. And it would just depend on like how many months you want to be in school essentially. So like where I live in Los Angeles, there's an accelerated program at Mount St. Mary's, which is a whole year and you only have like 1 month off. Or they have a MECN program at UCLA, which is a 2-year program and you end up with a master's. They're both the same. It just depends on like how fast you want the program to be, what kind of classes you want to take. UCLA, where I went to school, they have a lot of science-based classes, and sometimes to get in, they require extra science classes. So sometimes that turns people off from wanting to go there because now you're taking extra classes that you have to at your community college. So it really just depends on the type of program that you're seeking out and like how long you want to be in school. And yeah.
So for me, I'm kind of like Tricia's cousin. I already had a bachelor's degree. And so because I already had my bachelor's degree and it was non-nursing, I moved to Texas and I went for my associate's degree. I did, my program was accelerated, but it's actually a regular associate degree nursing program. So someone else coming in, if you were coming straight from high school, you would just have to take a few prerequisites and then you could still do, my program was only 16 months. So I started in August of 1 year. I graduated as an ADN/registered nurse in December of the next year. And then I was already working at the Children's Hospital prior to going into that program. So I just continued on, but now as a nurse. And then what I did was I went back to Texas Tech that fall, and my bridge program was only 2 semesters. And because I was already a registered nurse in the bridge program, I didn't have to do any clinicals. It was just all online classes. So I think I took a total of, I think it was 5, 10, like 20 classes in that time frame because they kind of broke it out 5 per 8 weeks. And then I had my bachelor's degree in nursing. So it really just depends on which way you want to go. As Trish was speaking to, because at that time, so I've been a nurse for 10 and a half years. At that time, hospitals weren't as bachelor degree picky. Now they have a lot of hospitals which have a status called magnet. So the hospital that I was working for, you weren't required to have your bachelor's as a nurse, but they were kind of holding off at that point, like no longer hiring nurses who were licensed practical nurses, and they really wanted you to have your bachelor. So they made a deadline of 2020 that every nurse had to have their bachelor's degree. And so that's kind of the thing. So knowing what type of facility that you want to work in, because that's going to matter. Which degree do you go for? Do you go for an LVN, which more than likely you may be in a nursing home, or do you pick to go to a bachelor's degree nursing program because you want to work at a big hospital. And so you have to start there because they're not taking nurses that are only ADNs.
And then going off of that and piggybacking off of that, so magnet is a status that is actually a nurse recognition status. Nurses made this status for like hospitals, and it basically shows that the patients are really satisfied with the hospital they're staying at. The staff is really good at interacting with each other, and the nurses are really happy with their job. And they use a lot of what we call evidence-based practice, meaning there's evidence and research that was done to show that like this is the best practice that you can do to take care of this patient and making sure that they have like a better quality of care essentially. And so to get that status, the hospital has to check off a bunch of boxes to obtain that status. And once they obtain that status, it kind of gives them this like gold star, this like recognition that they are a hospital that's really well liked, not only by the patients, but by the staff that works there and the nurses. And so a lot of the hospitals that have that status, they require people to have degrees to go back and get their bachelor's, like Simone said, because they want people to be using the topmost practice. So they want their nurses to be the topmost educated in terms of just like being able to do that extra research and go the extra mile and do the extra work. You don't have to work in a place that is magnet. It was just something that for me, where I live, especially a lot of the higher acuity hospitals, meaning the ones who had sicker patients, the ones where I would be exposed to more things and be able to learn a lot about that, they were the ones that were magnet hospitals. And so that played a big factor for me to decide that, okay, I'm going to go in and just go in straight and get my bachelor's and do the 4 years rather than having to go and do my ADN and then hope for a spot into a BSN program. Because something that you have to realize is when you are applying for a program, sometimes depending on how competitive your nursing program is, and competitive broadly, like I know there's a program at my local community college where it's a lottery-based system, and you could get into the lottery, but if you fail a class, then that's it for you. There's no retaking it, and then you are kind of have to find a new program to go to. So for me, I didn't want to jump through all those hoops, and I kind of just wanted to pick a program that I knew that if I got in, I was in the nursing program already, and that in 4 years' time, if I did everything I could to pass my classes, that I would get out with a bachelor's and then could take the NCLEX and then become a nurse.
That sounds somewhat terrifying, but I didn't know there were so many programs. That's interesting. I'm sure if someone wants to become a nurse, they need to do so much research into what path seems the best for them. Moving on, let me turn on my camera for 2 seconds, I'm sorry. Why did you choose your particular path? Did your plans change from when you were in your undergraduate or university years? Did you actually wanted to become a doctor first, or was nursing your first choice? How did you decide on your specialty, even within nursing?
So for me, as I was saying before, I have type 1 diabetes. I was diagnosed as a diabetic when I was 13 years old. And I had an amazing medical team that helped me, with all the hard learning how to give myself an injection. They let me poke them. So I was like, maybe I like this way too much. And so just having that medical team, I really, really, really wanted to be a doctor. Nursing was not the way that I was going to go. So my original degree was supposed to be exercise science, pre-med. I finished all of my pre-med coursework. My 4th year of school, I got sick. I didn't feel well. And I was just like, I don't think I want to continue on with going the pathway of becoming a doctor. At that point, I had graduated with my bachelor's and I moved to Texas, and I decided that I wanted to be a nurse. Now, I have always been specialized. Like, I've never worked in regular med-surg, is usually like a general nursing floor. I have only worked with children. So I started at a children's hospital as a CNA, and I stayed there for 10 years. I picked my specialty because I love kids, and also because of my diagnosis as a child. I wanted to be that person for the kids. I wanted them to see that, especially the diabetics. Hey, I'm diabetic too, but I was able to become a nurse. I don't have like complications of diabetes. So that's why I chose to go and stick with pediatrics the whole time that I've been doing nursing.
I work in the ICU, and originally I didn't want to be a nurse. My grandma was a nurse in the Philippines, and my mom was also a nurse. And I was like, well, if I become a nurse, then I'm just doing whatever they did. And I didn't want people to think that I was just doing it just because my grandma and my mom were nurses. And also because my grandma worked in the Philippines, I wasn't really interested in just kind of following orders blindly from a doctor. I didn't really think that that was like what I wanted to do. And it wasn't until I volunteered at the local hospital where I live that I realized that nurses have a lot more autonomy in their care. And so I volunteered there and got to see like kind of how they interacted with their patients and how they were able to talk to their colleagues as doctors and ask for suggestions. And I realized like, oh, this is something that I could probably get behind. It wasn't until my grandpa got really sick and he ended up in the ICU that I kind of found my calling. He got really sick, and I remember thinking like, I didn't know if he was alive. I didn't know what was going on. I didn't know what a ventilator was. And so in having that moment as a kid and being really young, I think I was like maybe like 9 or 10, I realized that I wanted to kind of cut that that lack of understanding. And I wanted to kind of provide education for families to be able to understand and make the ICU a less scary place for them to be, so that they could ask the doctors questions, so that they feel like they can speak up if they have a concern. And just to be able to sit a little bit more comfortably with all these machines around them and like be more like understand more and have less anxiety, especially because their loved one is sick. And so that's kind of really what inspired me to be an ICU nurse. So I kind of didn't know that I wanted to go into nursing, and then ended up finding my way back. And I love my specialty because I feel like like I said, there's a lot of autonomy in nursing, and I feel like I have a really good communication with the doctors who work on my unit. I can make suggestions and they don't like get mad at me for making suggestions. They're very open to teaching, open to helping me understand like why they chose this medication over that medication, and open to listening to my suggestions or my concerns for my patient.
Your reasons are all very noble. It's very inspiring to know that a calling was what pushed you to pursue your professions, and that you really enjoy it now. It all sounds very great. So what does your typical day look like? How do you manage your time between the different roles and spare your time to join our webinar today?
Trish, you want to
So
go first?
I work 3 days a week, which is really nice. So a kind of one of the cool perks about nursing, especially if you work bedside, they have a few different like hours. You can work 8-hour days, you can work 12-hour days, depending on the hospital that you're in and what specialty you do. So I work 3 12s. My full work week is 36 hours. And then if you want to add on and do like break relief and help break other nurses while they take their lunch, you can add on for an extra 4 hours, and that would complete 40 hours. But basically my whole week is only 36 hours. And that's kind of cool because I can travel like this. Like I'm not taking any vacation time by traveling. I'm just here on my day off, and then I'll come back and then go to work and it'll be fine. So my typical day, I start at 7 a.m. We have a huddle at the beginning of our shift. And basically we give updates on like who's the sickest patient on our unit, if there's been any changes in the equipment that we use, or any announcements overall that the charge nurse from the night shift will give, because I work a lot of days. And then after that, you get your assignment. It's on a sheet and it says your name and your patient's name. So you walk over to your room. The night nurse will be there and will give you a report on what has been happening, who this patient is, why they're in the ICU, what their diagnosis is, and walk you through significant events of like the hospital course of stay for this patient. then they'll walk you through systems. So like neuro all the way down to like neuro, heart, respiratory, GI, gastrointestinal, and then GU, and then walk you through like skin and anything that's going on with them, any lines that this patient might have, meaning like if they have IVs or the big lines that go into their neck that we also infuse IVs through, and then any like medications that they're on. So we'll go through all of that at the beginning of report. We usually like to do it at the bedside so you can see like in real time, like how the patient looks and like what, and so that the nurse doesn't forget to tell you anything. So by maybe like 7:20, 7:30, you'll have a good idea, a good picture of your patient, and then that nurse will go home. And then you'll look at your tasks for the shift. So there's different tasks for different hours that you have to do. And then you basically plan your care around if you're traveling, meaning like if you're going to CT scan with your patient, which is like where they take an imaging of the whole body, you have to take them to like a different department to do that. Or if they are going to dialysis or things like that. So you basically plan out your whole day. And it's kind of cool because you, for the most part, get a say on like when people come sometimes, or you'll call them and say, when's a good time for me to come? So you can start to plan like, okay, this is a good time for this person to come. This is a good time for this person to come. And then on my unit, we do rounds with the doctors anywhere from 8 to 10, depending on what bed, like what room you're at. So you know that the doctors are coming up. So you try to update everything from like their intake and their output, meaning like how much stuff they've gotten in, everything from your medications to your food, and how much they've gotten out in terms of like dialysis, and if they've like had any stool or urine, you write all that stuff down. And then what's cool about my unit is we give nurse-led report. So the nurses are the ones kind of giving the same update that your nurse gave you to the doctors. And then you, in that scenario where you talk to your doctors, you're able to ask for orders that you need throughout the day. On my unit, we do assessments every 4 hours, so 8, 12, and then 4 p.m. And then during that time, you run all your interventions. And a lot of it, honestly, when you work in the ICU, can seem like it's going through your head, because a lot of it's just like critical thinking and trying to manage and make things flow throughout the day, and like remembering what your big tasks are for the day and like what your critical points are for your patient. It can also look like titrating your IV medications and managing your ventilators and we have continuous dialysis machines on our unit. So managing a lot of machines and like making sure that the patient's stable. So a lot of this actually goes on in our head, and like just as you're planning everything out, and then having that dialogue where you're scheduling things and you're talking to different people. But it's really cool because I feel like where I work, it's always really fast paced and there's always something to do and something to learn, and things can go and hit the fan at any minute. So that's kind of cool to be able to like, you can kind of see when things like that are coming, and sometimes you can't. So being able to like plan around that and work around that is really cool.
Well, I'm glad you guys picked Trish and I, because our days are totally different. So I'm going to give you guys my three of how my typical day went. So pretty much the majority of my nursing career, I was a night nurse. In night nursing, and I was an ICU tech before I became a nurse, so I know ICU, but night nurse. I also worked at a teaching hospital, so kind of the same concept, but I did no rounds. Sometimes I might only see the doctor a few times in the night. So typical night shift coming in, I started my shift at 7:00 p.m. I got report from the nurses. We did start to do like a huddle where we would huddle with the charge nurse, so that we got to learn about all of the patients, kind of a little summary of all the patients on the floor. So that way, if somebody else needed help, we kind of knew about the other patients. Typical load was, I usually average about 4 patients. There's a couple times where I took 5, maybe because the nurse got sick and she went home. But a lot of nursing, especially with being a floor nurse at bedside, when I say floor nurse, is, prioritizing. You have to prioritize. So for me, my shift started with, which patient do I need to see first? What needs to be done first? So a typical night, it may start off, I'm going to do my initial assessments. I am giving out nighttime meds because usually meds were due at 9 o'clock. And we were able to start our 9 o'clock meds an hour ahead. So I could give meds for 9 o'clock between 8 p.m. and 10 p.m. So I would try to get all my meds in, meet my patients. And then sometimes I worked on an epilepsy unit. So it could be very eventful nights where there were seizures and you hear nurse to room 253 all night. Or it could be very quiet. The nice part about being a night nurse is like that my day nurses had to schedule around physical therapy, speech therapy. Okay, the doctors want to come in and do this and that. I didn't have to really deal with that at night because most of those people were not in the hospital. And working in a teaching hospital, we had hospitalists. And so those were the doctors that were staffed by the hospital. But sometimes, depending on what service they were on, the hospitalist might be at home because maybe they work during the day. So if that hospitalist was at home, then I had a first year and a third year medical student or a medical doctor, a doctor that was first year and third year. And they were the ones that were there. They were my point of contact. If something was going on, then that would be the person that I reached out to. So for the most part, because I worked on the epilepsy monitoring unit, we had those beds for that unit were only every 12-hour assessments. So you were only required to do one assessment per shift. Otherwise, you were going in, if they had seizures, because those kids were being monitored on a computer system and we were watching their brain waves all night. Otherwise, my typical general peds patients, I would do 3 assessments over the nighttime. So no sleeping is allowed. Just most hospitals have that somewhere in the policy. So no, I was not sleeping, but some nights it's like, what do you do to stay awake? Let's play cards. And other nights it's like you never get a moment to sit down. So that was my typical night for a lot of years. I will tell you, 3 nights or 3 12-hour shifts a week can spoil you. Because I stepped outside of that and tried to be a diabetes educator about 9 years ago. And I went to 5 8-hour shifts and I did not survive. I wanted to go back. I said, I don't like this. This is not for me. I work 3 12s. I don't have to request off to go to a doctor's appointment or to get my hair done. I just do that on my other 4 days off. So after I left that position, I actually went into what's called a PRN role or as needed. Now that one, it's worse than the 12 hours. I loved it because in the PRN position that I took, I was able to completely make my own schedule. So I did home assessments and I would go into their home for Medicaid and just ask questions. And what I would do is I would go on Outlook and I would say, okay, I am available on Tuesday from 12 p.m. to 5 p.m. I'm available on Friday from 8 a.m. to 1 p.m. The only problem with that is you don't get benefits and I only got paid if I was working. But what I loved about it was it allowed me to travel the world. They let me just, if I wanted to come in and work all of these days in a row, I would. So that spoiled me even more than my 12-hour shifts. So for the last 4 years, that's actually what I have been doing. And then I quit my job back in June. So now I am officially a full-time entrepreneur. So you work all the time when you're an entrepreneur, at least until I get my systems in place and my business running. So those were the typical days and things that I experienced in my nursing career.
And with nursing, there are so many avenues that you can choose. There are so many types. You don't have to do bedside if you don't want to do bedside. You can go and visit patients into their home if that's something you prefer. You can go and be a nurse lawyer. There's nurse lawyers, those nurses that work with data, they go into nurse informatics. You can teach if you want to teach. There are so many different avenues. There's a lot of nurse entrepreneurs now. We actually have like a National Nurse Business Association if you want to see like what nurses do in that regard and when they start their own business. So there's so many different roles where you could either work, like I said, 3 12-hour shifts. You could work 5 8-hour shifts. You could go in and work per diem or PRN. And so many different avenues. It just depends on what you'd like to do and how you would like to structure your day, and if you would like benefits, meaning like, if you health insurance, and sometimes some hospitals still do pension. It's really rare, but some hospitals will still do pension, or like help you with your like 401k, 403b, which is like basically where you put in money for retirement. So it just kind of depends on like what avenue you like. And basically, it's a lot of information, but you can start with, if you're into nursing, start with looking into like what kinds of nursing you want, or what types of hours you'd like to work, if that's kind of what's more important to you. But basically find something that's important to you within nursing that you'd like to pursue, and then go in that route and start to Google in that direction, and you'll find jobs like that. My mom's a nurse, like I mentioned, and she works from home. She worked from home pre-pandemic. She's a nurse case manager. And so she takes West Coast all the way to East Coast patients, and basically makes phone calls all day. She doesn't have to go into an office at all. She does have to work, like, I think she does work 8-hour days, but she can make that time up if she needs to on like a different day, and make those calls as long as she gets her hourly time. So it just really depends. And I'm just going to plug myself. I did make a day in a life nurse shift video for my night shift ICU, if I wasn't very clear, because there's a lot of things that in the ICU we do, so it's kind of hard to explain everything. But if you'd like a more clear rundown, I did make a video on my YouTube page, and go check it out.
Awesome. I'm going to check it out.
Thanks.
We'll be sending out, the contact information of each of you at the end of the webinar, so you guys can check out the link to that later. But to talk about your responses, I didn't know like nurses can do 3-day shifts. It sounds quite extreme. It's like one day you're completely chill, and the other day you either wake up really early or you stay up really late for a super long shift. It feels like it's a really extreme switch on and off.
Yeah, I definitely like it. I didn't know, like when I was in nursing, or before nursing school, I didn't know that nurses work 3/12s, because like I said, my mom worked from home. And so I didn't even know that that was a thing, but I've come to love it, just because, like I said, I can stack my shifts at the beginning of the week. So what I did for my trip is I worked Sunday, Monday, Tuesday. I flew out on Wednesday, and now I'm here in Texas, and I'll be here till Sunday, and then I'll work Monday, Tuesday, Wednesday of the next week. And then after that, I'm flying out on another trip. So I do that a lot. Also, you can also do travel nursing, which is where you do stints in different states. So I think normally those are 3-month contracts, but you can always extend. So those are nurses that can go to like let's say you're from California, you want to go to Colorado, you want to live 3 months in Hawaii, you want to live 3 months in New York, you want to extend your contract in New York. That is definitely an option to do nationwide, where you can go in different places. Or if you would like to go in and go to other places around the world, you can go into the military, and you can do Air Force nursing. My friend that I'm here with in Texas, she's an Air Force nurse. So she is actually from California, but she got stationed here in Texas. So I'm visiting her, and she has the option to move to Japan, Germany, all those other places, and work on the bases out there. So that's definitely an option to do. There's so many avenues that you can go with nursing. Like I said, you don't have to stick to one thing and do bedside forever. You can do so many things.
Sounds great. Like, I'm sure that the schedule a nurse has works great for someone who loves traveling and doesn't want to exchange, a typical 9 to 5 for, something more fun. So, talking about so many, unique aspects of becoming a nurse, what kind of students do you think would be a good fit for becoming one? Let's say, a high school student, because that's our main demographic. And is there anything you wish someone had told you before you decided on, your path of becoming a nurse?
I feel like you need to, what kind of student? Being driven, being goal-oriented. Sometimes you really have to be self-motivated, because sometimes it's hard. Nursing school was hard, choosing your path, which way do I go? even I'm sure with doctors, you have one way in mind, and then you get out there and you're like, oh, maybe I don't actually like this specialty, or you learn all of these things when you're in nursing school and you actually go over a lot of the specialty areas, and then it's kind of like, that's not as interesting to me. So I feel like you just, you have to have a desire to learn, because you're constantly learning. Things change. So one of the things I remember, they used to tell us this all the time in nursing school: you need to be flexible, be flexible, be flexible. And I was thinking, okay, this is like a nursing school thing, if she tells me be flexible one more time. But then I realized in the real world as a nurse, you have to be flexible, because science, everything changes. They come out with new research, and now you're changing the way that you've learned to do something. For years it was this way, and then they say, oh no, we've done all this research and it's better if you do it this way, or we're going to take this step out. So just being flexible and being open to learning new things and gaining that knowledge, because some things you can't just be like, oh no, I'm not going to do that, I don't need to learn that, because evidence-based practice, this is the best way to do these certain things. And like an example I can give is when I was trained in nursing school, when we were giving intramuscular injections, you were taught to pull back a little bit to kind of aspirate, make sure you don't get any blood. They actually decided, evidence-based practice, that you can just go ahead and do the injection. Now, is there a wrong in still checking for that? No. And so in that case, it might be a step that you could still have in there when you're actually, so like getting the flu shot. You might still see a nurse who kind of pulls back on the needle before she injects the flu shot. So things like that can be something where it's like, okay, and then you have to go to they'll add a class, or they'll say, okay, I know you just worked this 12-hour shift, but we need you to stay extra 30 minutes to learn about this new system or new way of doing things in the hospital. So I feel like you will learn as a student. You're going to have to be flexible in the things that you learn, and being just open and willing to take in that information, and just having that desire to learn.
I think for me, the kind of student, yeah, I agree with Simone. Definitely be willing to learn and be willing to help people. And I know that's so cliche. You always hear that a lot from people when you ask them why they want to be a nurse. But it can be really hard to help people, and there's different avenues to help people, I think. And so when I say helping people, I mean like you want to get in there and you want to help them in like a long shift, like you're working like 8 or 12 hours. You want to get into the nitty gritty and be kind of really micromanaging and helping out with their care in that sense. I also think that there are different types. I think that there's no stereotype for a nurse, which I think is really cool. There's no stereotype of like what a type of nurse. There's different people who become nurses that maybe you won't expect. But I do think that there's a niche for every type of nurse. An example I'm thinking of in my head right now as I'm saying this is we had a girl on our floor who basically, when you become a nurse on my hospital, you go through a 6-month orientation stint. And it's different at different hospitals, but if you're going through a new grad program, meaning you're fresh out of school, you've never worked bedside before, other than just going to your clinical hours, meaning like you're a student and you're watching a nurse, but you weren't registered before. If you're new, you usually apply through a new grad residency program, and you have an orientation and you're on probation for a certain amount of months. At my hospital, that's 6 months. And at any time at all, they can decide to let you go, meaning they can put you on a different unit if they feel like you're good, but you're not a good fit on our specific unit, or they can let you go altogether, which is really scary. But I think that there is a beauty in that, in the sense that maybe you just weren't a good fit for the floor. And I think the example that I'm thinking of in my head is that there was a girl on my floor, and we work in a really high acuity, like high paced, really sick ICU. And that was kind of stressful for her. But where she really thrived was in psych nursing, where she could really get to know her patients and, like And that's something that I don't think I could do. Like, I don't think psych nursing is for me. I think that that's a very hard specialty for me if it was the other way around. So I think that there are different avenues for different people in nursing. And it just depends on finding your niche of like, do you like high paced, or would you rather like have multiple patients and maybe work with a certain specialty of patients? I have a friend who works med surg, and he works with a lot of cancer patients. So he actually can go through the whole hospital and administers a lot of our chemo drugs, and he gets to know like all of our patients who have cancer, whether they go into the ICU or not. They end up back on his unit, and he takes care of them if they're not as sick. So it just depends on if you want to specialize on to a different type of specialty, and then knowing like what your strengths are and what you're good at. For me, that was wanting something that was fast paced, wanting something that made me want to be on my feet and think quickly. And so that's the type of specialty that I chose. And then I think something that I wish that someone had told me before I went into nursing is to just kind of like be persistent, and if it's something that you really want to do, to continue to try and do that, and don't let anyone tell you no. Because I think there was a lot of people growing up that maybe have told me like, oh, UCLA is a hard program to get into. It might not be worth applying, because they, didn't want me to be sad if I didn't get into it. But if I had listened to them, then I probably wouldn't have gone into the UCLA's program. I wouldn't have met the friends that I have today, and I wouldn't have been able to probably get the job that I did, because I did a lot of my clinical rotations where I am working now. So just be really persistent and really kind of explore your avenues, and don't be afraid if someone says, hey, I think that's too hard, or no. It just means, okay, go in a different direction, but at least you tried. So don't let someone say no to you. Allow yourself to have that opportunity, and then if it's not, then pivot and go in a different direction.
Hey, Trish, good word. That was supposed
Thank
to
you.
be my word for 2021. Pivot.
Pivot.
But yes, like you have to learn to pivot. To go back to that first question, a couple things that I feel like kind of students and a good fit that I forgot to mention is one of the major things about nursing is critical thinking. Like it's kind of, you can learn it as you go, but at the same time, you kind of have to already have some critical thinking skills before going in. And that also pulls into time management, because time management is major. You think, you go in one room and you're stuck in there and you're not managing your time. Something happens, critical thinking, now we have a priority and I need to go see my next patient. And I've seen nurses where they didn't realize, hey, that was a priority, and then somebody else had to step in. And like Tricia, I've been saying, safety first. And so critical thinking and time management are major parts of that. Time management, getting medicine out on time, because that could affect that patient. So those are just, as you go through and going through high school, do you have good time management? Are you getting your assignments done on time? Are you able to do these things without somebody having to tell you to do them? Because you're not always going to there's not somebody there next to me to say, Simone, did you give your medications? It's on me. So just having that time management. And then as far as anything I wish someone had told me, I think mine are more towards actually once I already knew I wanted to be a nurse. So one of them was pathophysiology. When you take that class, please pay attention. That class, I did an online pathophysiology with the community college, didn't really pay attention. I'm like, if I paid attention to any class in nursing school, it should have been that. It is the breakdown of all the diseases, all of, things that are going on in your body, and it gives you so much information. Honestly, I feel like it is a lot of the foundation. And I didn't pay attention well. In my 4th semester of nursing school, I was required to write a patho statement every week. I was like, what is this? So if nothing else you hear from me tonight, when you take pathophysiology, if you decide to go this way, please pay attention. Another thing is, Trish was speaking to it, but I wish somebody would have told me about a nursing residency. Now, they can be different at different hospitals. But when I say nursing residency, I mean the one like, oh, I had the name of the school on the tip of my tongue, but I can't think of it. But in the nursing residency program, which I didn't find out until my last semester of nursing school, and the one that's at the Children's Hospital that I left, they allow you, you have the program is maybe 6 to 9 months, but you go through times in each area of the hospital. So instead of picking one specialty coming in, it allows you to go through, have time on each floor, 2 to 3 weeks on each floor. So you kind of get to see hands-on, okay, this is what they actually do. I didn't have that. I went right into one floor. I got hired at the Children's Hospital, and this is where I went. So with that opportunity, once you go through all that time, then you pick your top 3 and say, okay, I like these. So if I had to do it all over again, I definitely, oh, it's at Vanderbilt. That's where I did a research paper about it, but that's where I definitely would have tried to do, so that I did have that opportunity, because maybe I actually went into epilepsy because that's the floor that diabetes was on. Epilepsy wasn't the plan, diabetes was the plan, but I may have picked a different specialty. Maybe I wanted to do gastrointestinal and help people with their stomach. You know, it's just so many options out there. So I feel like that type of program allows you, just even if it's a short amount of time, you get to see hands-on what it's like to be in those different areas.
And then if you have an opportunity, I would definitely like pick people's brain. Like if nursing is really something that you want to do, go out and find people that you can talk to and ask them a little bit about what they do. If they don't have a lot of time, maybe just ask them, like if you're messaging someone on Instagram that you follow, like a nurse influencer or whatever, just ask them like, hey, like I really think what you're doing is cool. Can you tell me a little bit more about your job? Or if they have time to sit down with you, because like I said, sometimes it's really hard to explain like what we do in just like one message and one blurb. Ask them if they can sit down with you, if they have like 30 minutes to be able to explain a little bit more about what they do. And definitely seek out different avenues. Like I said, there's different avenues to nursing. There's the travel nursing, there's nursing in the military. So different avenues. And if you see someone or you know someone that you can talk to about that, definitely seek those out, because sometimes it can be unclear when you go into nursing that there are so many different avenues to go into. So the more you're able to verbalize what it is that you want in nursing, or even if you have some sort of interest, people can point you in the direction so you can talk to someone who has been through that or experienced that.
I'm sure talking to someone, can prove very helpful with finding a path. There's so many paths. So I think that might require a lot of people, talking to a lot of different people. Moving on, I think this is the last question. We might be a little, early with ending this, but I think it's fine. So finally, what advice would you give to high school students who are considering a career as a nurse? What should they do currently to prepare for it?
Trish, you want to go first?
Sure. Like I said, don't take no for an answer. Definitely seek out all your avenues and pivot if you're hitting a wall, pivot, because the answer isn't no. You just kind of have to figure out where you're going with everything. Find people who support you and who support your dream of becoming a doctor or a nurse, and like mentors that you can talk to about the best way to be able to go through that and the best way that works for you. And also just like really kind of hone down on focus in on what you want, but also like don't be afraid to ask and don't be afraid to go seek out different places. And then there's something that I wanted to say that was on the tip of my tongue. Nursing is often romanticized. Like you see a lot of people that are on YouTube or Instagram that are like, oh my God, I love my job. And just to keep it real, nursing can be really hard sometimes. Like a lot of us are burned out from COVID and dealing with this pandemic, just like a lot of the general population is burnt out. So really kind of understanding on both sides, like what you're getting into, whether that's going into nursing school and realizing the stress that nursing school can be. Having a good support system for that is great. And also just kind of having a strong backbone to continue in nursing, and also realizing like the pros and cons of the different specialties that you're going to go into if you do decide to become a nurse. And yeah, but overall it's great. Like I love my job. There's days where I don't like it, but other days it's great. And just having a good group that you can like laugh about, talk about work stuff with, the days that were really hard and the days that were awesome and great, is amazing.
Trish, I totally agree. Pivoting, you're gonna have to pivot. I tried radiology anesthesia for 3 months. Wasn't for me. So if I had to give advice to high school students, I know Trish spoke to it earlier. This is something I also did when I was in high school, but I would say get out there and volunteer. I volunteered at the hospital, and depending on, there's different programs across the US. Like at the Children's Hospital I worked at, I actually worked at the hospital in Dallas, and we allowed our volunteers, they would come in, they could hold the kids, especially our little kids that were all alone. Sometimes it's just nice to have somebody to sit there and hold them. And I've had them, ask me if I was doing something. Of course, you can't, there's no patient information, but if they wanted to stand in the room and watch me do something, I was fine with that. So it just kind of depends on the hospitals and finding out what they actually allow you to do as volunteers. But you don't have to just volunteer at the hospital. There are various organizations that allow you to volunteer. I know another thing that they allow, which I wish that I had this pathway when I was in high school, because I'm originally from Iowa. So the same things I've seen in Texas, I didn't see there. But in Texas, a lot of the high schools have medical programs that you can join. And one of the high schools that I was helping at, they allow you to get your CNA, which is Certified Nurse Assistant, while you're in high school. And then it allows you to work in the hospital. So that's another way to take advantage, because you're building that relationship going in and already, which is why I did it the way I did. But, I came in as a CNA. I already had that position. So when I graduated nursing school, I just slid right into my nursing position because I already worked for that hospital. So it was kind of like, okay, we'll take somebody who's internal. We already know her work ethic. She's been here for years. So that was helpful to me. And then just same thing, always seeking out opportunities, coming to conferences like this, talking to nurses, doctors, learning things. You should be at this conference every year, learning from different people about what's going on, what type of area are they in, what do you need to have to get into that same field. So I just say, get out there, find opportunities, read as much as you can. I'm sure that this magazine and newsletter is going to give you all of the information you need to be successful.
Thank you for the promotion. Appreciate it. And thank you for your amazing advice. I'm sure it'll prove helpful to someone here. So to the attendees, if you have any questions for Trish and Simone, please send them in the chat. For now, I kind of have a question. How has COVID-19 affected your work? It's a lot of in and outs and a lot of, staying at the hospital, which and wearing a mask for 12 hours sounds kind of suffocating, let's just say. So how has, the pandemic affected your work, figure the schedule or like just the day-to-day?
So for me, because I was no longer bedside when COVID-19 happened, I was actually working my as-needed job, going to homes. So we stopped going to homes. And, of course, it took them a little bit. It was kind of like, okay, there's this thing called COVID, and they were kind of hesitant. Well, we think you can still go to their home. And then they kind of got some pushback, or you find out another company has stopped their nurses. Like a lot of the insurance companies have nurses that go out and do assessment. And so we completely stopped going to homes. Then that's what allowed me to move from Dallas to Houston in that time frame, because I was only doing assessment over the phone. They actually still have not started to go back into homes just yet. It is governed by the government because it's Medicaid. So at some point when the government says, hey, you have to go back in, they will. But as of right now, it went from going into homes to do the assessment to doing them over the phone. And they've just kind of started to implement video, because I can't really say that, something was going on, or it's hard to do an assessment over the phone. There's certain things in the questions that I'm asking in my assessment that I need to see for myself. Now, I wasn't allowed to touch them, so even in the home, I couldn't touch them, but doing it by video, at least I could see. So for me, because I wasn't still in the hospital, the only change was I just do the assessment at home.
So I worked in a transplant surgical ICU. So a lot of the people that we deal with normally are immunosuppressed after they get their transplant, so that they don't reject their new organ. So in my hospital, we have multiple ICUs, and my ICU was actually considered the clean ICU. So we would take all the critically ill patients that did not have COVID into my ICU. Now, the nurses on the COVID unit at my hospital, they were getting super burnt out. So what would happen was they actually asked us if we wanted to volunteer and be mastered into the COVID ICU for like a month. And so I actually went ahead and did that. So I ended up working in the COVID ICU for a month, and it was really a great learning experience to honestly see it firsthand. We had a lot of really, really sick patients, and they were all on ventilators for the most part. They were on continuous dialysis machines to like filter out their blood. They had a lot of IVs, and what we would do is we would place the IV poles actually outside of their room so we could titrate the medication to what we needed it to be without having to go into the rooms. And something that I really love is that this inspired a lot of like really nurse camaraderie, and like nurses were super duper helpful. So if they were gowning up to go inside a patient's room, we actually had sliders in between our ICU beds, and so they would be like, hey, do you need me to do anything for your patient next door? And because we knew that both of those patients had COVID, they would just slide through, change a set of gloves, because we would double glove, and they would work on that patient next door, even if it wasn't their patient. And so that was kind of awesome to see, like, that nurses work together and just kind of help boost their morale, because it took a village. We had patients that were lying on their tummies for a lot of the time, because that was the only way we could get them to oxygenate very well. And even when you turn them, even if it's just a small amount, they would drop their oxygen levels, and it would take a really long time for them to come back up. So you'd have to stay in there until they come back up, and it would feel sometimes like forever, because if their oxygen dropped, there would be times where their blood pressure would drop, and someone's outside helping you titrate the medications to keep their blood pressure up while you're working on the ventilator inside and making sure that this patient doesn't code and doesn't need very, very emergent support. So it's an interesting experience, definitely really scary. My hospital, I felt like, did a really good job to protect us and have good patient ratios, which I can't say for all of the hospitals in California. California by law is protected under safe patient ratios. So the cool thing about us is that the max patients that we can have in the ICU is 2. And if you work as a floor nurse, the max is 4. But in some hospitals, they just didn't have capacity. They didn't have the staffing. So the floor nurses were getting anywhere close to 8 patients, anywhere from 6 to 8 patients. And they were very scared, because that doesn't happen in California. And then the ICU nurses were getting 3 patients, and they were all vented on continuous dialysis. And it was very scary in other hospitals. So we were very fortunate that we didn't have to experience that. And we also had a decent amount of N95s to protect us. And what they would do to kind of help us keep the N95s is they would UV light ours, which they were doing studies on it before, but it's shown effective to prevent COVID or kill off the COVID. So we actually were able to use an N95 that was UV lighted up to 5 times, and then we could toss them after that, which kind of helped save our supply. And I was part of that, where I had to do that, and I didn't get COVID, so I think it was kind of helpful, and it worked for the most part. But it definitely scary. They had patients who like were not COVID, and then they would test them every day, and then on the 5th day they ended up with COVID. So literally like 25 people, RTs, doctors, and nurses, had to be like off unit because they were quarantined now because they were exposed to someone who had COVID. So scary time. A lot of learning had to happen. A lot of like morale boosting had to happen. All the other ICUs like came to help rally for this one unit and be like, thank you for taking this head on. You know, you didn't really have a choice, but thank you so much for doing this and like trying to help out in any way that they could. So that was really cool to kind of see that, but also really scary.
I cannot even imagine. And if anything about being flexible, because you never know. Like we went through the Ebola, and we had on the floor that I worked on, we had a set unit. We never got a kid with Ebola, but we were the hospital in Dallas that was set up to take, because it was a county children's, take whatever child ended up with Ebola was coming to us. And so you have to roll with it. Also, but in being flexible, it also remember being safe and speaking up when you feel like something is not safe.
Not to end the webinar on a heavy note, but I always think that those who aren't affected by COVID-19 as much often don't have the true understanding of how much work and how much hard, effort, it takes for, healthcare workers to battle against the pandemic. So thank you for sharing your experiences. And I think since there hasn't been anything in the chat, I think it is a good time to stop the webinar. And not stop the webinar, but end the Q&A session. Regarding the contact information on the right, we have Trish and Simone's contact information there. You can go watch Trish's YouTube video. Yes, it's in the chat. That's good. So if you guys are interested, you can go look at her channel and take a look at Simone's Instagram as well, where she talks about her diabetes advocacy. And not to plug ScienceHolic, but here are our socials. We're mostly active on currently Wechat, because our Instagram has been somehow disabled we genuinely don't know, but we're trying to get it back. So here are our socials. It's mostly ScienceHolic, so you can go search it up. And if you want to work with ScienceHolic to our high school attendees, you can scan a QR code, you can screenshot to scan it for later, but you can join as a team member, become an ambassador like Jessica, who has been so helpful in helping organize this conference. We have our blog and magazine article submissions, our review, which is our way of helping high school students get their research papers published, because we saw a lack in that area, and our mailing list, our newsletters, updates of our organization, like this conference, sent straight to your mailbox. So here are some ways you can help with us. And yes, thank you so much, everyone, for joining. This group is a little bit small, but I feel like it's a little more cozy, and we've got to delve really deep into nursing. So thank you, Tricia, Simone, for your precious time and speaking to us today. We all learned so much, and it's been really fun hearing you all talk. Yeah, thank you so much.
Thank you for having me.
Thank you.
Thank you, everyone. Hopefully tune in, at 9 for our next session, which is in 40 minutes, I think. Yes, something like that. So yes, thank you so much. Thank you for joining, and I'll see you all next time. Thank you.